All right. So welcome everyone to our November Burnout Prevention Action Group meeting. This is going to be my first time hosting without Sam. She is so dearly missed, but she is doing great at her new job. I knew that there's going to be some big shoes to fill, but I'm excited. I'm excited to start leading and get this started. So I want to begin by just taking a mindfulness moment. I'm going to set a timer for just 1 minute, and I want you to just sit and really be in the moment. Just focus on your breathing, focus on how your clothes feel on your skin, your hair feels, little things that you may not notice because we're just taking so much sensory input all the time. So just take 1 minute to be mindful, because we all know mindfulness prevents burnout. So I'm gonna set a timer. I'll turn my camera off as well. Feel free to do whatever you need. And let's begin. All right. Hopefully everyone got a little something out of that, a little bit of relaxation. Now let's begin. Let's go over our agenda for today. So I want to remind folks about a wonderful burnout prevention opportunity that we have coming up in January. That's going to be our Perfectly Imperfect workshop. And that's going to be in January 21st of this next year. It's coming up real soon. This is going to be a workshop specifically for parents and caregivers that have teenagers, and just how to help them out with their mental health while also taking care of your own mental health, because we all know it is easy to get burnt out yourself when you have a teenager, for sure. So yeah, if you guys would like to sign up, I believe I sent out the Eventbrite, but if you missed that, I will send it out again. Feel free to ask me for any more details. Yeah, if you or any of your colleagues have teens that you work with, this would be a wonderful opportunity for you. So today we're going to focus on meaningful opportunities for self-care in the workplace. I have compiled a list of existing activities and also potential activities that I believe could be implemented and would be really helpful for preventing burnout. I have a running list going, so I will stop sharing my screen in a moment so I can take some notes, and I would love to hear all of your suggestions on things you know that already exist or ideas you may have. So we'll stop sharing my screen and we'll go into that. Right, so some existing opportunities that I know are happening at the moment is call-in meditation at the Jefferson Public Library. Yeah. And so sometimes I will lead these. We have our wonderful coordinators on our team, Sarah Bass and Charles Floyd, who also host. This is just a 30-minute quick meditation. Anybody can join. You don't even have to be in Jefferson County. And it's nice to just take 30 minutes out of your day to be mindful and relax and not focus on your work for just a moment. So that, I believe, will be really helpful for Burnout. And if y'all would like some more info on that, I can send out the link. It's free, accessible to anybody. Feel free to share that with whoever you think would benefit. There's also a wonderful website called the Free Mindfulness Project that has numerous ideas on wonderful things you can do for yourself and implement in the workplace. I could list all of those, but that would take up more than this meeting time. There are just so many wonderful opportunities on that website. So I can send a link to that as well. Feel free to check that out. And then one thing that I believe is kind of self-explanatory, but really putting emphasis on mental health days. It's really difficult to separate your work life and your personal life. I know that it's been said that you need to just leave your baggage at the door when you step into work or you step into something else, leave everything else behind and just focus on that. But that's really difficult to do because we are one person, and all of that baggage is a part of us, and it's hard to separate that. And so I want to emphasize how important it is to take a mental health day. It's just like when you're feeling sick physically, you would take a day off. It's equally as important, if you're not feeling so well mental health wise, to take that day off and not worry about having to leave any baggage at the door. So again, those are the things that I believe already exist. Does anyone know of any other opportunities that exist currently?
Hey Rachel, it's Erica, and I apologize, I'm driving, so I have my camera off. I don't know if Sam shared, but after our last meeting, I had contacted her because I had a conversation with Karen Quanbeck, who is the superintendent of Clear Creek School District. And she had mentioned that she was, at the time, just getting ready to go superintendents from different school districts for a mindfulness and like a burnout prevention retreat. And I was like, well, that's kind of funny that you're doing that. And they were able to do that through a grant that CEI, the Colorado Education Initiative, was able to procure in combination with some of the school districts. And she had mentioned, she's like, you might want to see if, the group, this group could potentially work with CEI or another organization to try to find if there are any grants out there that are specific to burnout prevention in this area, where we could potentially get some funding to, and it, who knows, because of grants being so specific, maybe it would be more specified to, like, say, school counselors, we could do some sort of a retreat for, or something like that. But I definitely think it's something worth looking into to see if there is grant funding available for something like this. And we may even have potential partners that could help us procure a grant, such as CEI. So just a thought.
Yeah, I love that. That sounds amazing. I can, do you know a good contact at CEI that I could reach out to?
I can get that information. Obviously, like I said, I'm driving, so I don't have any information off the top of my head, but yeah, I can definitely get that information and send it to you.
Awesome. Thank you so much. Yeah, that sounds like a great opportunity.
Yeah.
I would love a mindfulness retreat.
Yeah, right.
I think we could all use that.
Yeah.
Amazing. Cool. So I'm taking notes of all of your suggestions, and I will send this out at the end of the meeting so everyone is in the loop. That's amazing. Awesome. Now I'm going to go into some potential activities. These are just some fun ideas that I came up with that I personally think would help me with my burnout. And feel free to jump in if any of you have some suggestions. I want to note that some of these will probably require maybe some funding if it's in the budget, or it would definitely need to be coordinated with managers or wellness coordinators if you have that at your organization. But I think these are some reasonable, fun little things that would help with burnout. So one thing I have is a very laid back work day. I was thinking about like wear your PJs to work day. Because I know that a lot of us work from home these days and we're probably in our pajamas. I am right now. But if you have to come into the office, I would be more motivated to do that if I could also be in my pajamas. So I think that would kind of create an atmosphere of relaxation, and just some general good vibes in the office, just laid back, chill days. I think that could prevent burnout for sure. And that's something you don't have to, that does not require funding or anything. Um, Another thing would be to do like a fun food day. Maybe once a week, once a month, whatever is in the budget, but have like a pizza day. Or in the winter, I was thinking like a really cute little hot chocolate bar with like fun little toppings and everything. And then maybe an international food day, which could also celebrate diversity, equity, and inclusion. So that could count for those activities. And that would be a really cool way to learn about other cultures. If there's anyone in your organization that is part of a certain culture that would like to teach more about it and celebrate with some food, that I think that would be a really fun way to not only prevent burnout, but connect with everybody and celebrate our differences. Another thing is having a professional organizer give a presentation. Someone like Marie Kondo, if you've heard of her, like, do your items spark joy, you know? I think because organization is a huge preventer of burnout. And I think we all probably struggle a little bit with organizing the million things that we have going on all the time. So to have someone come present on how to organize your life, I think that would be very helpful. The last thing that I think that would be really wonderful to have is designating a safe space in the office, just so that all employees have access to a room where they can just detach from their work environment. Not everyone also has a physical office. So I know when I come into the office, I'm usually in one of the conference rooms that's public and shared, and it's definitely not a private space. And I think it would be very beneficial to just have one designated room where you can kind of take yourself away, have a moment for mindfulness. And also possibly, this would be really fun if it could be kind of like a nap room, like where you just put in a bed or a couch or something. Like if you need to take a 20-minute nap, I think that would definitely prevent burnout. I think everyone would love that. Yeah, just not getting enough sleep can lead to burnout and also cause a lot of various mental health and physical health issues. So yeah, I think a nap is pretty beneficial to everyone. So yeah, those are just some of my fun ideas. I know a lot of them would probably need some higher up supervision or whatnot. So we'll see how we can implement all of those. But let's see. Do any of you have any opportunities? I see Ashley has raised her hand.
Hi, good morning. So I really love the idea about being able to share food and maybe something that's culturally relevant to you. One of the best icebreakers that someone did was to share their favorite, like Christmas, Hanukkah, whatever holiday, what food is your family favorite? And it was really interesting to learn about other people and, I think to look at me, you wouldn't know that I'm Middle Eastern, but to share that, and it just really, helped with feeling a little bit more connected, knowing somebody a little bit better. And our psych assessment manager, she's awesome at doing different activities, but every week she features somebody in her newsletter. And it's like get to know Ashley better. And then I write up, my history and how I got to be at Porter or Centura, but also other things about me. And it's really kind of a neat little addition to our newsletter. I'll also say we have a great EAP. And we have something now called Precipio, where I can go in and listen to like a topic that I'm interested in. So I did the kind of the declutter, being organized, paying attention, and how to refocus because I have a terrible scroll habit of getting distracted. So, and I just really appreciate that Centura has these and it pops up in my email with recommendations, and that it's okay for me to take 30 minutes and listen to something like that. My role is my title is Quality Outcome Program Coordinator. It is specific to behavioral health and our community health improvement plans around youth mental wellness, school district relationships, stigma reduction, and suicide prevention. But those, it's just really nice. And my favorite app is called Insight Timer. There is so much free content on that, and I will use that at work and, take a few minutes just to ground myself. That's it. I'll breathe now. Thank you.
Awesome. Thank you, Ashley. Yeah, that is super cool. Believe we also have something similar at Jeff Center. Whenever there's a holiday coming up, we do feature an employee that celebrates that holiday or is part of that culture. And they share a little bit more about it and some of their personal experiences. And I think that's amazing. And we should all be doing that. It's a great way to learn about your coworkers and get more cultured. So yeah.
And Rachel, is part of this conversation also with having the I'm sorry, I'm already forgetting the name of the event in January.
Oh, Perfectly Imperfect?
Yeah, will there be resources for parents? Do they provide them? Do you provide them? A
Um,
resource list?
yeah. So that's going to be a workshop for a whole day, and they will be providing lots of resources and training on how to deal with mental health and teenagers. Yeah, I could send you some more info if you're interested, for sure.
Yeah, I would love to see that. Thank you.
Awesome. Yeah, and I can also connect you with Cass Walton or Mary Moxley from Pikes Peak Suicide Prevention that is hosting that, or that is presenting that. So yeah, they can also give you a lot more details. Perfect. And okay, bye, Sophie. Thanks for coming.
Hi, everybody.
And
Hi.
Sarah, I see you have your hand raised.
Yeah, can you hear me okay?
Mm-hmm.
Okay, fantastic. Yeah, I'm just curious if anybody has kind of figured out how to incorporate more physical movement into the day-to-day work, because I think that's a huge opportunity, especially in healthcare. We walk around a lot, but we don't necessarily get out and go for true walks to like overcome stress in our bodies. So just curious what others have done, if anything.
Yes, actually, something that Sam used to do with our engagement team is have our like weekly meetings somewhere in the community. Like we would go to Sloan's Lake and just take a walk all around while we talk about all our work stuff. So we got to have our exercise and it's productive. So if that's something that your team leaders or you could incorporate, I think that would be a wonderful opportunity. Mary Pat, I see you have your hand raised.
Yes, I do. I have been involved in prevention of burnout presentations locally, nationally, and internationally, and absolutely love the subject of preventing burnout. In reference to physical, I am now in an office. I have not been in an office since I was 19 years old. I am a nurse that works out in the field. And so what I do here in the office is I take time. I walk 3 miles a day in my 8-hour day. Also, in reference to physical, I've also been a nurse educator since 2007, teaching our nurses. I teach them in mental health as well as community health and other areas of nursing, but I have been teaching them self-care since the beginning. And we do walking rounds. So we'll go outside and walk and do rounds. And we also, in community health, I will take them to Denver and to different places to learn about organizations, different organizations. And we just do that by walking throughout Denver, walking up in Evergreen to community resources. And that's kind of how I maintain my mental health. And back to the retreats, I think a burnout retreat, prevention retreat would be wonderful for parents, kids, And we actually did a retreat in Evergreen. This was a number of years ago, where Stanford Hospital sent 14 participants to Evergreen, Colorado, Stanford from California. All expenses paid on grants for a 4-night, 3-day, what was it, 3 days, 3 full days, all expenses paid retreat. And it was phenomenal. And to see where those people are today is like, it's a wow factor in terms of the resiliency and that prevention of burnout, and those moving forward teaching others about prevention of burnout. So, and thank you, Sarah, for mentioning Vital Hearts. I appreciate that.
That's awesome. Thank you so much, Mary. That's amazing. Yeah, that, and the group from Stanford coming all the way to Evergreen. That's awesome. And it's great that you saw so many results from that too.
Yeah.
Yeah, it proves that it really works.
Yeah, I
So-
saw one of our participants in 2019. I was in an international conference in South Carolina, and one of the California gals was at the same conference. And it was a wow factor to see how it has grown in terms of that prevention.
Yeah, amazing. Yeah, so retreats work. Mindfulness retreats work. We need to get that grant funding. Implement this everywhere.
Yes.
Yes. Awesome. Does anyone else have any ideas? Okay, awesome. So I have written a lot of these down, and I will be sending these out to you again. Now I want to shift focus on to next steps. So how exactly do we go about implementing these in our organizations? Some ways is definitely like speaking to coordinators that would be in charge of bringing in guest speakers, or grant coordinators to see if we can get that the CEI grant, or any other kind of grants that'll get us these mindfulness retreats. It's definitely just like speaking to people, but does anyone else have some ideas?
We have a committee here at the hospital that basically oversees everything related to our caregiver wellness and engagement. So that's something I would take to that group to figure out how to implement. I know not everybody has that kind of a group, but it's a really great resource for us.
Yeah, that's awesome. Yeah. So if any of you have a wellness coordinator or an engagement coordinator, marketing, even possibly communications, yeah, just bring up some of these ideas to them, explain the importance of burnout prevention and how this will affect the organization as a whole. Because you want everybody to not feel burnt out, to feel relaxed and present in their work. Yeah, awesome. So I think mostly it's just bringing it to those who can make these changes. Maybe that's you, maybe that's someone else, but yeah, we gotta communicate with other members of our organization to see how we can implement these. And then a bigger question is, how do we implement these into the community? Ultimately, we want to try and prevent burnout for everybody, all populations. And it's a little more difficult to try and get this out into the community. Some ideas I had is possibly marketing events that that you host, or that you know are being hosted by other organizations in the community, like the meditation, since that's open to anybody. Possibly marketing that a little more, spreading awareness that these opportunities exist. I was thinking possibly creating a toolkit. I mean, Stephanie gave that idea to me, actually. I think that would be really awesome to have, just kind of some suggestions on what you can do to prevent burnout, like a definition of burnout and how it happens, who it can happen to. Just giving anybody a free and accessible toolkit on how to handle it. I think that would be a good option to try and create. Does anyone else have some ideas or what could be included in that toolkit maybe? That's definitely one we're gonna have to brainstorm on.
Artwork.
Hard work.
Yeah, something crafty.
Yeah, doing
Did you say
collages,
artwork? Yeah.
artwork.
Artwork.
Yeah.
Yeah, absolutely.
Mindfulness through the arts.
Yes. Love that. That can be the name of an event. Mindfulness through the arts. So do you know of any existing opportunities like that?
It's all in my head.
Yeah.
Actually, if you look at the art centers, like we have a wonderful art center up in Evergreen,
Mm-hmm.
and bringing mindfulness there, maybe even bringing Jefferson Center,
Yeah.
and collaboration and doing something in reference to arts and mindfulness through the arts.
Yes, I love that. Oh yeah, totally. That could be something we could do. We could even maybe possibly collaborate with some schools and have like a field trip day kind of thing, and just to go and
Mhm.
yeah, do some art, look at some art. I like that. Okay, well, this could be something that we just think about and come up with some more ideas at our next meeting. Just think about some ways that we can implement all these into the workspace and also into the community. I also want to think about how we can implement self-care into remote work as well, since I know that a lot of us are working remote these days. So does anyone have any ideas of what you can do at home?
I go to my playhouse.
Ooh, Playhouse.
Yes, I
What's
have a playhouse,
Ooh.
and I think just being out in nature. I mean, being out in nature, just going outside, breathing fresh air.
Yeah, absolutely. Yeah, we underestimate the importance of that for sure. I know at Jefferson Center, we have one wellness hour a week that we get to use however we like. I like to go and take a walk during that time, just clear my head, take myself out of that workspace, even though it's at home, take a nap, eat some good food, watch an episode of your favorite show. Yeah, just having that 1 hour to have back in my day is really, really beneficial. So that's something we can also think about implementing into organizations. That's something that's possible. Awesome. So now just thinking about some meeting times for this action group. Do you all think that we should meet again next month, or do we need a little bit more time to think about these opportunities and how to implement them? Because we could also do a meeting in 2 months. What do you guys think?
I think with the holidays upon us, it might behoove us to really focus on some self-care and some, what can we do as members of our neighborhoods and communities?
Mm-hmm. Yeah, absolutely. So do you think that we need to take that time just to ourselves and maybe meet in January?
I don't know, what do others think?
I guess it would help me to know kind of what the goal is, to know when we would want to come back together. I guess I'm just not clear on kind of what the end game is.
I like that, Sarah.
Yeah, I think our goal is to think of ways that we can implement this into our workspace. So that is speaking with those coordinators that can implement these activities. So maybe we need a little bit more time to try and implement those and then come back and share if you've managed to get these implemented into your organization. And then think of some more ways that we can implement it into our community, any existing opportunities, and yeah, just reaching out to folks and seeing what we can do to just raise more awareness for burnout and implement into organizations and the community. That's what our goal is. Does that make sense? I know I'm rambling.
Yeah. I mean, to me, that's just an ongoing piece of work. Like
Right.
it's something that we have to do every single day. So, I think meeting after the holidays is totally appropriate to give us time to I think Mary said, do some self-care.
Yeah, definitely. I agree. Okay. I will set out another doodle poll for a week in January that might work for folks. I think that will give us some sufficient time to think of all these awesome opportunities and try and implement them, and also just enjoy our holidays and focus on not getting burnt out ourselves. Okay, awesome. So I will also send out my notes from this meeting, and then if anyone has some additional opportunities or ideas that they would like to share, feel free to send me an email or give me a call, and I will add those on there. Perfect. Any last questions or anything anyone would like to add?
I'd just like to add something. This is Mary Pat again. I've been working for the last year and a half, 2 years with a group of physicians and other healthcare providers. And with that group, the term burnout is not so much used as is moral distress. So for a lot of providers, it's really, if you're looking at providers, and of course we're looking at the whole entity, the children and adolescents in our schools. But I think that's another area to be looked at, is that moral distress, not necessarily burnout. I just wanted to throw that in there.
Yeah.
But thank you, Rachel. Thank you for this.
Yeah, of course. And yeah, thank you for that. Moral distress. I don't know if I've heard that before. That's
There's actually national legislation that passed in reference to moral distress.
Oh, wow.
Yeah, because we had an ER physician that completed suicide during COVID. And so there was a bill on honoring her name.
Yeah, that is very unfortunate. Yeah. Definitely moral distress in healthcare. Yeah, that is huge.
Big.
I can't even imagine having to work in that environment, and like that is crazy burnout for sure.
Yeah, it touches a lot on the ethical issues too of caring for COVID patients, but just patients in general during these times when contentious times. We'll just put it that way.
Right.
Oh, thank you, Sarah.
Yeah, absolutely. Yeah, so let's come up with some ideas on how we can really implement this into healthcare, and raise a lot of awareness for these opportunities for healthcare workers. They are absolutely experiencing a lot of moral distress and burnout. Awesome. And thank you, Sarah. Thank you for the toolkits. Yes, that will be awesome. All right. Well, this took less time than I expected. I'm happy to give you guys 20 more minutes back into your day. Any final questions? Anything else I can do for y'all?
Let's get walking.
Let's get walking. Absolutely. Yes. Everyone take these 20 minutes and go outside. You got to do it. All right.